Hello, my name is Jacob Asa. This is for KN 530. This is weekly assignment number 6. This is my volunteer James, and today we'll be showing you some stability exercises for upper and lower extremity post-op for the meniscus surgery and for rotator cuff and labrum surgery to stabilize the joints post. The first upper extremity stability exercise we'll be performing is horizontal band pull-aparts. You'll have your client put the band up shoulder width, arms slightly wider, and they'll retract the scaps and pull apart horizontally for 5 to 10 reps, focusing on scapular engagement and postural control, making sure they're not hyperextending their lower back, and making sure it seems as if they're pinching a pencil with their scaps when they retract. The next exercise for upper extremity stabilization work will be standing external and internal rotation. For this one, you will hand the client a band. They will put their shoulder and their arm at 90 degrees, and they will slowly pull upwards, engaging the rotator cuff and stabilizing the shoulder girdle. The next exercise in upper extremity stabilization work will be wall push-ups. This exercise promotes stability in the shoulder complex and strength in the bicep, tricep, pectoral group, and the back of the upper back. So you'll have your client put their arms just outside shoulder width and just vertical in line with the shoulders, and you'll have them perform a push-up just like they would on the floor, focusing on good form, keeping the elbows tucked into the body, sucking in the core as well, maintaining lower back stabilization and posture. The next exercise in the upper extremity stabilization work will be seated press-ups. This exercise focuses on the delt, tricep, and teres minor in the shoulder complex. You'll have your patient grip the armrests of the chair. They will have a nice tall spine, very postural, and they will lift themselves up, fold, and drop back down. And they'll do that for 5 to 10 reps. The last exercise in the upper extremity stabilization work will be the sleeper stretch. This stretch is given to a lot of patients who do rotator cuff surgery or Tommy John in baseball players. What you want to focus on is when you have your patient, they lay down, they support themselves under their shoulder, down their side, and they'll be at a 90-degree angle. They'll place their hand on top of the other one, and they'll slowly work down on internal rotation as far as they can go comfortably, and then they will hold that position there and breathe 5 to 10 seconds, and they'll come up and they'll do another 5 to 10 seconds. This exercise focuses primarily on the infraspinatus and the teres minor. The first exercise in the lower extremity stabilization work will be wall slides. This exercise is done where you step off the wall just slightly, almost where you're leaning against the wall. You'll have your feet shoulder width apart, and then you'll slowly slide down while bracing your core, and on the way up, you'll push your lower back into the wall as you slide up, resisting the urge to lean forward and create more torque with your legs. This exercise promotes core stability and spine stability, along with hip mobilization and glute and hamstring activation. The next lower extremity exercise for stabilization of the knee will be lunges. This exercise is performed when you take your dominant leg, you put it forward, you put the knee over the toe, and you lower yourself, pausing both at the top and the bottom, focusing on posture and control while you go up and down. The muscles that are used in this exercise are the glutes, the quads, the hamstring, and the calves. This exercise also promotes knee stability and hip mobilization, as well as ankle mobility and stabilization. The next lower extremity stabilization exercise is the half squat. This exercise is performed by getting into a normal squat position, focusing on toes forward, good posture, and lowering to the point that your erector spinae no longer contract and are no longer part of the equation. This exercise promotes introduction of the erector spinae in the movement, as well as continued contraction in the hamstrings and the glutes to work on hip stability and strengthening muscles like the glute medius and the glute minor throughout the whole movement. This movement also promotes core stabilization and spine stabilization as well. The next exercise in the lower extremity stabilization work is going to be the standing abduction. This exercise is performed when the patient stands on one leg, focuses on their balance and their core engagement, while lifting their opposite leg up into the air and returning it to the floor and holding it 1 second on each. This is going to promote involvement of the glute minimus, the glute medius, and the IT band, and work on knee stabilization for the stable leg, and hip mobility and stabilization on the lifting leg. Can you hear me?
Yeah.
The final exercise for the lower extremity stabilization work will be hamstring curls. This exercise is performed on the ground, preferably on a slick surface, where you'll put a towel underneath the patient's heels. They'll retract and bend their legs just slightly. They'll lift and elevate their hips off the ground, and they'll pull the towel into them, and they'll extend their legs back out, maintaining core stabilization and spine contraction and lower back stability. This exercise promotes knee stability, hip stability, core and spine stability, as well as involvement of the glute complex, the hamstring group, both calf muscles, and the abdominals. You should do this exercise 5 to 10 times, rest, and do another 5 to 10. Good. Thank you for watching. This was a exercise on the stabilization work for upper extremity and lower extremity exercises to promote stabilization in joints after post-surgery, for example in the shoulder a labrum surgery, and in the knee a meniscus surgery. Thank you, James, for volunteering.
You're welcome.
This has been my assignment. Thank you.